Okay, welcome back. Are you ready for some medical conversation? I am. Because today we're going to delve into the issue of back pain. Some people have had back pain not knowing the source of it, how to treat it, and then we do all kinds of maybe even the wrong exercises to aggravate it. And so today we want to talk about back pain, probably we should be getting from Genesis. We might not get into revelation of it today, but the doctor is here to do justice to that. And you know, the doctor from the Bank Hospital. Good morning, Dr. Wisdom.
Good morning.
You good?
Very well.
Don't wear same color.
The spirit is one.
Most definitely. Anyway, but before that, do you look through your partner's phones?
No.
You don't?
No.
Because you trust them?
Yes.
Shit. All right. Doc has passed the test. Okay, so back pain. Back pain. I want to take it from a personal point of view. I've had back pain for a number of, for a very long time now. Not knowing exactly where it's coming from. You know, like when I sit for long, I stand for long. And some people tell, oh, it's the heels. I mean, ladies, you know what I'm talking about. And so why, if it's the heels, why is that men also face the same thing? So this whole idea of back pain, tell us, why is it that we're worried about fever, malaria, arthritis, and all of that? And then we have to add that back to it. What's the idea? What's the story? Yeah. What causes that?
Yeah. Interesting. And I like the fact that you said that you don't know where it's coming from.
Yeah.
I think that for us to understand exactly the causes of back pain and exactly where it's coming from, we have to look at the anatomy of back pain. It's amazing how we tend to squeeze this volume of things just in a short time for our audience.
Well, you're good at it.
Yes. So let's take a sneak peek at the anatomy of the back. So if you look at the spine is, I would say, is the bony framework of the body. Like, it runs through from the head down to, even holding up your pelvis and your legs. Now, the spine, there's an image. I'd prefer the image rather than the video now.
Okay.
The image first.
If we can have the image, please.
Yes, the spine runs through from the head, goes down. So it holds the head. That's where the head sits on.
Okay.
And then at every point where as it descends down, the name changes.
Oh.
The name of the spine changes, yeah.
Really?
So
it's not just bone. Can we have an image, not the video? That will help us. Thank you very much. Great.
Yes.
So there it is.
So at every point as it goes down, it changes. So from the part that holds the head and the neck is called the cervical spine. Oh, right. As that same spine goes down to the part behind the back that holds the chest cavity.
Okay.
Your chest cavity is where you have your heart, your lungs, your blood vessels, major blood vessels. That part of the spine is called the thoracic spine. So I'm sure there's an image like that.
Spine. Okay.
Thoracic spine, right. Now, as it continues down to the part behind the tummy, you see the part behind the tummy.
Okay.
And now the tummy is what holds your abdominal cavity. Okay. You have your kidneys, you have your stomach, you have your liver, intestines. That part of the spine is called the lumbar spine.
So the layman would say that's the waist.
Yeah, exactly.
Right.
So that's what holds, the pelvis, so that making up the waist, if you would like to call it. Now, as it descends down, the other part that curves like a C, which is like behind the buttocks, right, is called the sacrum and the coccyx. This is what I was looking out for. So you see, the same spine from the top, called the cervical spine or vertebrae, comes down to thoracic, lumbar, sacrum, and so it's just one spine. And it tells you how enormous, the kind of thing that it holds, and holds several organs coming down. So that is why your spine is very important. And the way God has created it, you see, it looks like an S. There's something we call a normal lordosis of the spine and normal kyphosis. So you see where it's bent like a C, it's supposed to be bent that way.
That way.
Where it's bent like a K in front, it's supposed to be bent that way. That's how it's supposed to be. So now anything that happens to distort this normal anatomy causes back pain.
Right.
Great. So delving deeper, you realize that these are bones. And you look at in between the bones. Now the video can come. In between the bones, we have, like cushions. You see like those blue things over there. They're like cushions. They help the bones. Can we
have the video, please?
Yes, you see, these are cushions. You see, it helps the bones move, or else your bone moving without that cushion can cause a lot of pain. So we'll talk about some causes of back pain where, this cushion is deteriorated. We don't have it anymore.
Like it's dried out.
It's dried out to cause you severe pain. Right. So those cushions in between. Now, behind those cushions is a canal called a spinal canal.
Okay.
Now, within this canal is a spinal cord. Right. It's a spinal cord. So I wish I could control the video with my eyes. Right.
Yeah.
It's going ahead of me. It's a spinal cord. Right. So that's a spinal cord. Great.
Right.
So this spinal cord runs from your brain down to the end of the spine.
Okay.
Now, as it comes down from your brain, it sends out smaller branches, like we can see on our screen now. At every point, sends out smaller branches at every single point to supply, your arms, your chest, your tummy, your legs, even how you control your bladder, how you urinate, and how you use the water. So it gives you control over it.
Wow.
So if there is anything that would impinge on any of these nerves, cause you severe pain. Do you understand? So, so that's how come when you have back pain, we have to analyze to know exactly where is this back pain coming from.
Right.
Where exactly is it coming from? Now, the first things we look at as physicians is we look at the site where you're having the pain. Exactly. You realize that pain is more common in the lower back.
Yes.
Yes. Now, what holds this bony structure together are so many other structures. We have the muscles, we have ligaments, we have tendons. So these structures are soft tissues. Okay. They help the back move. You can bend. Or else if you are stuck bones together, there's no way you can bend those bones, right? But you can
that's what
bend,
makes it flexible.
Flexible. You can bend, you can twist, you can turn, you can do so many because of these, structures that hold the bone together.
Nice.
Right. So any injury to any of these structures, the muscles, the nerves, the ligaments, the tendons, can cause pain.
I see. So then it means that first off, we would have to have a thorough examination before we start to buy medications.
Exactly.
Because you see, you're in a car, Nigerians will say a bus, and then there's somebody comes, when you buy this, all your back pain will go, So it means we need every other thing to run. Maybe is there a test?
It's an exam. A clinical exam.
Okay. How is that done?
An AI cannot do that for you.
Oh.
An AI cannot.
You're preaching now. So don't just get on Google like my back aches and take this antibiotics.
Exactly. An AI would not do that for you.
But so I walk to the hospital. I have backache. It hurts. Maybe from here all the way down to my waist area. And so how is the examination done? Great
question. So before we examine, we ask questions, right? Take a good history to understand when did this pain start, right? So first of all, we want to find out where exactly is the pain. They want to ask you, when did it start? Did it start sudden or it started gradually, right? There are some pains that start gradually. Before I continue with that, there are two classes of the cause of back pain. We have the mechanical cause and the medical cause.
There is a mechanical
cause and the medical cause. So mechanical cause would be anything related to the bones, the muscles, the tendon, the ligaments, all those structures would be a mechanical cause.
Okay.
And then the medical cause would be medical conditions, underlying conditions, infections and all that can cause back pain. But people are not aware of that, right? So we ask you the site, where exactly is this pain? When did this start? Was it sharp? Were you just then you had a sharp pain, or started gradually? And we want to find out the character of the pain. Is it a sharp pain, or is it a dull pain? Some people just have dull pain. Some people have very sharp pain. You know, I want to ask you how often it comes. Is it mostly in the mornings or mostly as you get up and you start walking, and throughout the day, then you start having the pain even more? Or maybe it gets better as the day goes by, you know. So we have to understand, you know, that. We want to find out, does it move to any other part of your body? You know, there are certain people, they have back pain, it comes to the tummy, it moves to the front. Some people have certain back pain, it moves to the buttocks and then down to the legs. Yes, I'm sure. I'm seeing someone saying, yes, it's true.
Your eyes are open.
I'm seeing someone say, yes, it's true. I've been experiencing it. But yes. Sometimes it moves from your buttocks down, maybe just one side, down to your toes, yes. And then there are certain people that this pain is associated with other things. So we ask you the other factors that comes with the pain. Some people don't have control over their bowel, control over their, you know, bladder. When they want to urinate, it just comes. But this will also having back pain, you know. But if you don't know, it's I said the eye sees what the mind knows. So if you don't know, you'll not be able to tally or marry both together. And other factors that could come along with it. Do you have a fever? Are you vomiting? You know, and all that. So these are associated symptoms that you could have with back pain. And then want to know the character, the severity of the pain. Right. So this pain, on a scale of 1 to 10, a lot of people get asked this question when you come to the hospital, where 10 is the worst pain of your life and 1 is the least. Where would you grade it? So that will give us an idea as to, even if you have to give you medication, what type of medication, because we have to ascend through, you know, WHO has a ladder, we call it a pain ladder. We have to ascend through, you know, down to the top. So this gives us an idea of what kind of pain it is, right? So we go through these motions before we come to examine you, and the examination is quite extensive, you know, and then together with investigations, x-rays, MRI, depending on whatever the person is thinking. Well, we have a spinal camp coming up. I'm sure we'll talk about that.
We'll talk about that.
So that detailed exam will be done in that spinal camp, that detailed examination, and it's individualized. You know, if you're having neck pain, the exam I will do for you will be different from someone who's having a waist pain. And the most common pain really is a lower back pain. You know, and research has it that 4 out of 5 people in their lifetime would experience lower back pain.
Well, that's literally everybody.
Everybody. You know. Yes, 4 out of 5 would experience lower back pain.
I see.
Yes.
So how long would it take? I mean, because I'm thinking that I come to the hospital, I have back pain, and you have to go through all these examinations. How long, like which one is the longest? How long does it take to find out exactly what's wrong? And then, I mean, I'm in a hurry. I want medication. I want the pain to go.
Yes, it shouldn't take that long, really. When we talk about the treatment, maybe not today, you'd realize that it's not all medications, not all back pains that we use medications to treat. For some of them, we use physiotherapy, physical therapy. You know, for some of them, we use stretches, exercises, like we've been doing in the morning. It's here, right?
Yes, wake up fitness. If you weren't part of it, you wouldn't be having that problem.
For some of them, we do surgeries, you know, and then for some of them, we have to find the underlying cause. I mentioned medical causes, find them and treat them. Right. So let me just talk a little bit about the
camp. I know that you're fired up with that. So
no, the courses. I was just to highlight the courses.
How about we just talk about one, and then we can get
Great. So one common cause of back pain is posture. Your posture. Right. Sometimes, so we call it muscle sprain. So the way you sit, the way you twist and turn, the way you do rigorous activities can cause a muscle sprain, right? Can cause a muscle sprain. And I mentioned that the muscles hold these bones together. So if the muscle at one point, you know, there's an injury to a muscle at one point, it could pull on these bones, and that could cause pain, you see.
Thinking about it
could
is already
pull.
Painful.
And sometimes some people sit down, you know, wrongly. You don't sit down upright. Some people, you know, some people sit down and then they've twisted, they've bent, you know, relaxing on the chair instead of sitting upright. So that could also cause back pain. And also sitting down for a long time.
How long is too long?
So usually we would say between 30 minutes to 1 hour. Get up for a bit. Get up for a bit, you know, and just walk around and come back and resume.
Really?
30 minutes to 1 hour. So you could
30 minutes to 1 hour?
Yes.
You can't tell that to a lab technician.
But you have to be intentional about it. I mean, you don't have to get up and walk around. You just get up for a bit, stretch for a bit, and
then you
back.
doctors are also at risk, because I see a lot of doctors seated, and then maybe what was the name? You have about 30, 40 people in Africa, where most of the hospitals, the doctor to patient ratio is so large, and you have lots of people sitting outside. You're just sitting and just doning out medication. You're killing yourself. It happens to you guys a lot.
That's why we need more doctors in the system.
Right.
So the ratio would reduce and we'd have time, for ourselves.
So ideally, we should be sitting for an hour, 30 minutes to an hour.
Then you get up for a bit.
And you get up.
Yes.
And move about a little.
So for me personally,
sit down.
I use an iWatch. So at every interval, it tells me it's time to get up. So I just get up, walk around. So I do that in between patients. So let's say I'm done with one patient, it's leaving, another patient's about to come in. I quickly just get up, stretch, and then it comes in and I sit down.
Let's get into the stretching. Some people get up and they go all the way. Probably they might do the stretch wrongly to injure the thing. So when you get up, what exactly do? You just get up and stand?
Yeah, so you just get up and just minor, stretches. It doesn't have to be something
rigorous.
Great. Yeah, just to relieve your back of that tension, because you've been seated at a particular position for a while. So there's an amount of tension, especially the lower back, right? So once you get up, you free that tension and then you go back again. So basically, that's the whole idea.
One of the things I really would love to talk about is sleeping position, but not today.
And lifting heavy objects.
And lifting heavy objects. My God.
It's amazing.
This convo is, we put a pause, like ping on it. Next Thursday, we're going to continue that. We want to delve deep into it. We're dealing with existential issues. We're dealing with things that you do during the day that might become a problem. You want to be a part of it. You want to contribute. You want to send in messages and ask the doctor all this, so that we would, give him the chance to explain all these things to you. So you don't want to miss that session on Thursday. Right, but before we go, the doctor has a spine camp. We should be talking spine awareness camp.
Yeah.
Right? So you're going to teach us about spine, and that's it?
So basically, you want to screen your spine. There are people who have experienced this back pain for a long time.
Right.
Now, I didn't mention that one of the risk factors, the red flags, we'll talk about it on Thursday, to spine is a prolonged period of back pain. So if you had it more than 6 to 12 weeks, that's a chronic back pain. You need to check it out. You need to check your spine out. There are a lot of people are suffering from this condition. You have no idea.
I see. So when are we having this?
So this from the 20th to 31st, 20th of February to 31st of March. Yes. It's at a very good package where you'd have a consultation with a neurosurgeon, who studies in details the spine. You have that examination I spoke about. And then you'd even it includes a physiotherapy session after the consultation. So it's a whole package. There's also a scan. You could also do an X-ray, to determine what the cause of your back pain is. So it's a whole package. If you have any of the warning signs, you have back pain, difficulty in walking, and all that.
Where is that happening at?
This is happening at the Bank Hospital.
At the Bank Hospital. So we're not going to Kumasi this time around. So we're doing that here in Accra, the Bank Hospital in Accra, right?
Yeah.
And then it's from 9 a.m. to 5 p.m. each day.
Yeah.
Okay. So from 20th February to 31st March 2025. Great. We should be there. Yeah, right? Yeah. Can we book online or
just walking?
Just walking.
You'll be attended to.
All right. So you heard the good doctor. We're taking good care of you. We're taking good care of your back. Because, we need you to be healthy, walk healthy, stand healthy, sit healthy. Right. So thank you so much, Doctor. I can't wait for us to talk about the effect of phones and social media and all of that. We saw the effect of social media on marriages. We want to look at that on yourself. That would be a good conversation, right? Okay, so put a pin on it. Thursday, we'll be dealing with all of that. This has been Health Matters with me, Biadola. We're going to go for a break, and then when we get back, Koku will take over.